Well, more than 446,000 Australians are currently living with dementia. That's according to Dementia Australia, making it the leading cause of death in the country.
Without intervention, that number is expected to increase to more than 1 million by 2065. But cognitive decline isn't inevitable. This morning, we're revealing how to boost brain health at any age. And for more, we're joined now by Professor of Ageing and Mental Health at UNSW and co-director of the Centre for Healthy Brain Ageing, Professor Henry Brodati. Good morning to you. There is a common misconception that cognitive decline is inevitable. You don't subscribe to this.
Cognitive decline does occur with age, but not for everybody. If you look at centenarians, half will have dementia, half won't. So people can live to 100 years old without dementia. Yeah.
OK, so you talk about the fact that we can do so much to prevent cognitive decline.
Yes. Talk
us through some of your non-negotiables for better brain health.
Good education, keeping our brain active.
From a young age too, isn't it?
Even better, yeah. So education at a young age is even more important, yes.
So what kind of things? Like, what are the specifics that people could be doing every day to sort of ward this off?
Well, from a young age, is getting a good education, staying at school right through to year 12 and perhaps even doing further education. In adult life, keeping your brain active is important. So people who work in more complex occupations with more people skills have less dementia. People who are more involved in academic pursuits or using their brain in other ways. People can do learning new skills such as a musical instrument or a language. That also stretches the brain too. Yeah.
What about social interaction? How important is that?
Social interaction is important. Keeping mentally active, physically active, socially active are three of the main areas to work at.
You've had first-hand experience with this. Your father had dementia. How has that shaped your research around this topic?
Well, I became involved in setting up what's now called Dementia Australia back in 1982 at a state level, then a national level, and then at international level, and eventually started seeing more patients in that area. I'm a psychiatrist working with older people, and then I started doing research in this area. We ran a large research trial with over 6,000 people. We just focused on 4 things people could do: keeping brain training using computer cognitive training program, physical exercise, good eating based on the Mediterranean diet, lots of vegetables, legumes, extra virgin olive oil, and moderate amounts of fish and smaller amounts of dairy and eggs and lesser amounts of red meat and processed food, ultra-processed food. And depression anxiety treatment. Now we want to extend this. We want to include more social interaction, better blood pressure control, that's a major risk factor. And we published this study about this time last year. And now we're really trying to promote a healthy brain promotion program for the country, and we'd really like to do the slip, slop, slap of brain health, or the move, munch, mind, as it were, of brain health.
OK, move, how much? So if people are watching now,
yes.
What are the guidelines around that?
Well,
or
the minimum is half an hour
a
a day, 5 days a week.
Could it be a walk?
A walk probably not enough. If the walk is you're getting puffed and sweaty, that's good. Both aerobic exercise and strength training are important. So doing both. A leisurely walk with your friend having a chat is great, but it's not enough.
All right, the second one was munch, is it?
Well, the Mediterranean, diet that's healthy diet, low in saturated fats, low in ultra-processed foods, more vegetables and legumes. And then the third thing was keeping your mind active. There are computer training programs. In our program, everything was online. We had over 6,000 people, and we had the best results yet published in the world. We also showed it was cost-effective. That the cost of the program was more than offset by savings in other health costs. OK,
so if people are at home right now, they might not have had education from an early age, or they have been eating badly or whatever. What can they do today? What is an achievable thing that they can do today?
They can start exercising now. They can start eating a healthy diet. They can stop smoking. They can not drink alcohol to excess. They can protect their heads if they're in any contact sports or riding bicycles. So they can do all of those things. And if they've got hearing problems, wearing a hearing aid can also reduce the risk of dementia. So there are things that are very achievable.
And go and see the GP and get your blood pressure checked.
Definitely. Blood pressure, cholesterol, and sugar.
Well, we know that so many Aussie families are being touched by this, and the numbers show more and more are being touched by it every year. Henry, thanks for your time this morning.
Really interesting.
Okay, thank you very much. Thanks for inviting me.
Well, if you want to donate to fund vital research through the Centre for Healthy Brain Ageing, as we've just heard about, all of the details will be on our website.